Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Saifuddin Bin Khairuddin. So today I would like to present my economic project assignment entitled Quantifying the Stroke Threat, a multivariable analysis of age, body mass index, and average glucose level. Okay, abstract. This research explores the risk of stroke by analyzing age, BMI, average glucose level. We using a robust method and a diverse data set because the study finds that higher age elevate BMI and increased glucose levels are significantly linked to an increased risk of stroke. The finding emphasized the importance of considering these factors together in assessing stroke risk. In conclusion, the research provides valuable insight into quantifying the rates of strokes, advocating for holistic healthcare strategies targeting age-related, metabolic, and lifestyle factors. Okay, a little bit about the introduction. The first one is global significance of stroke. This research is focused on the worldwide impact of strokes, a major public health concern causing substantial illness and death. And this study aims to contribute valuable insights to address this global burden. And the second one is critical research gap, because there is a notable gap in understanding how age, body mass index, and average glucose levels collectively contribute to stroke risk. And this research seeks to fill this gap, offering a more thorough examination of these factors and these interconnect impact. And the third one is practical implication for public health, because this study aims to provide practical information for refining risk assessment models and informing preventive strategies. Because by understanding the complex interplay of age, BMI, and average glucose levels, the research seeks to contribute to effective public health measures that aim at reducing the impact of strokes. Okay, literature review. Age and stroke risk. Numerous studies emphasize the association between age and stroke risk. For instance, Smith et al. 2018 found a significant increase in the stroke incidence with the advanced age, highlighting that age as a critical factor in stroke susceptibility. Body mass index. Body mass index as an independent risk factor. The research by Johnson and Brown 2017 provide evidence that obesity measured by elevated BMI independently contribute to an increased risk of stroke. Their studies suggest that mechanisms such as hypertension and atherosclerosis play crucial roles in the BMI stroke relationship. Okay, data description. Because this study, we aim to investigate the complex relationship between the interdependency between the brain stroke and several factors that leading to the disease stroke, such as age, body mass index, and average glucose level in blood. So here is our equation. Stroke equal to B naught plus B1 age plus B2 BMI plus B3 average glucose level and plus U. So the dependent variable is stroke in our data, 1 if the patient has stroke and 0 if not. And the independent variable, the factor, B1 age of the patient, and B2 is the BMI, body mass index, and B3 is the average glucose level in our blood, and U is the error term. Okay, about the methodology, how we process the decisions. The first one is data collection, where we get the data from diverse groups, ensuring that privacy and techniques, including stroke occurrence, age, BMI, and average glucose level. And the second one is the descriptive statistic. We calculate the average, the variabilities, the distribution measures for each variable to understand their characteristic. And the third one is multivariable analysis, because we use a multiple linear regression to assess the relationship between the variables and estimate coefficient, check the significance, and calculate the goodness of fit, the R squared. And the fourth is hypothesis testing. We test if age, BMI, and glucose levels significant affect the stroke occurrence. And the fifth one is the interpretation. Uh, Interpretation to understand the size and direction of relationship by interpret the regression coefficient. And the sixth one is the model evaluation. We assess overall model fit using R squared. We evaluate how well the model explains the stroke occurrence. And the last one is the limitation and implication. We address the study limitation, data quality, and generalizability, and we discuss how findings impact stroke prevention and intervention strategies. Okay, now we go for the chapter 4, the descriptive analysis. As you can see, the folder here is the result we get for the age, BMI, and the average glucose level. And we will go through one by one. Okay, the first one is the mean. The mean values indicate the central tendencies of each variable because the mean age of approximately for age is 49.49. That suggests that on average, the individual in the dataset are around for 49 years old. And for BMI, the mean is 28.19, signifies the average BMI among the individual. Similarly, the mean average glucose level of around 110.24 indicates the typical level of glucose in the dataset because this means serve as a reference point, providing a sense of the central value around which the observation cluster. And the second one, we go for the standard deviation. The standard deviation gives insights into the spread or dispersion of the data point. A larger standard deviation for age 23.68 implies that the age are more spread out from the mean, indicating a greater diversity in age. For BMI, the standard deviation of approximately 6.66 suggests less variability compared to age because the higher standard deviation is observed for average glucose level. It is 52.45, indicating considerable variability in glucose. And the third one is kurtosis. Kurtosis measures the tail of the distribution. Negative kurtosis for age is negative 0.89, suggests that the age distribution is slightly flatter than a normal distribution, with fewer extreme values in the tail. Positive kurtosis for BMI 0.19 and average glucose level 0.48 indicates slightly more peak distribution, suggesting the presence of outliers or a heavier concentration of values in the tails. And the last one is the skewness. The skewness describes the asymmetry of the distribution because negative skewness for age, negative 0.45, indicates a slight leftward skew, implying a longer left tail. Positive skewness for BMI 0.50 and notably higher positive skewness for average glucose level 1.31 suggests a rightward skewness, indicating a longer right tail. This implies that in the case of average glucose level, there might be some individual with higher glucose level contributing to the rightward skewness. Okay, now for the sample correlation, as you can see in the picture, the first one is the correlation between the age and BMI. The correlation coefficient is positive, which is 0.37. The magnitude is moderate, is indicating a moderate positive relationship. And this suggests that as age increase, there is a moderate tendency for BMI to also increase. And the correlation between age and the average glucose level, the correlation coefficient is positive, which is 0.27. Uh, and also the magnitude is moderate, indicating a moderate positive relationship. And this also suggests that as age increase, there is a moderate tendency for average glucose level to also increase. And the third one is correlation between BMI and the average glucose level. The correlation coefficient is positive as shown in the picture. It is 0.27. The magnitude is moderate, indicating a moderate positive relationship. And this also means that there is a moderate tendency for individuals with higher BMI to also have higher average glucose level. Okay, and then next we go for the variation inflation factors. As you can see in the picture also, there is age, BMI, and average glucose level. The variance inflation factors value provide for the model's predictor variable, the factor, the age, BMI, and average glucose level. indicate that multicollinearity is not a significant concern. Why? Because with VIF values well below to commonly accept threefold of 10 and even below 5 for each variable, there is no evidence of severe correlation among the predictors. And this suggests that the predictor in the model do not exhibit high level of interdependence, and their relationship with the response variable can be individually assessed without the interference of strong multicollinearity. Consequently, the model is unlikely to suffer from the issues arising from high correlation among the predictor variable. Okay, this is the simple linear regression. As you can see in the picture, there is regression statistic. The result, the multiple are 0.4730, the R square 0.2238, the adjusted R square 0.2199, and the standard error 0.444011, and the observation in our data is 201 people. And besides that, the coefficient, the intercept, and the age, the intercept. So the equation in this simple integration is y equal to b naught, the stroke, plus b1 age plus u error term. And this paragraph discusses the result of simple linear regression analysis. The intercept is b naught equal to negative 0.1605. The stroke represent that the estimate by y value when x1 is 0, and the positive slope coefficient b1 is equal to 0.0091. This indicates a positive relationship between the dependent variable y and the independent variable s1. And specifically, as s1 increased by 1 unit, y is expected to increase by 0.091 units on average. And the R square value 0.2238 reveals that approximately 22.38% of the variation in y is explained by the linear relationship with S1. And with the positive slope coefficient, the model aligns with the expected positive relationship. So, in summary, the positive slope coefficient suggests a positive relationship with the R square value, indicates a moderate level of explanatory power in the model. Okay, now we move to the multiple linear regression. As you can see in the picture, the regression statistic is the same, and the coefficients between the intercept and the three factors, three variable, age, BMI, and average glucose level. Okay, the intercept B naught is the stroke. It presents the estimate of stroke risk when all variables are zero, but such values may lack meaningful interpretation in the health context. And the slope coefficient B1, B2, and B3 is indicate the change in stroke risk associated with a 1 unit increase in each respective variable while holding the others constant. And specifically, an increase in age B1 is equal to 0.0091 is associated with a rise in a stroke risk, while higher BMI B2 is negative 0.0029 is linked to a decrease in risk. Additionally, an elevated average glucose level B3 equal to 0.0005 is associated with an increase in stroke risk. And for summary, these picture provide insights into how each variable, the age, the BMI, the average glucose level independently influence the risk of stroke in the studied population. Okay, for the slope coefficient, we compare the two models for the simple linear regression and multiple linear regression. And for the simple linear regression, for age 0.091 and the R square is 0.2238. Meanwhile, the multiple linear regression, the for age is same, and for the R square is 0.2273. It's a different slightly different. And the comparison of slope coefficient for age in both the simple linear regression and multiple linear regression it reveals a similarity, indicating that the inclusion of the additional variables for the BMI and average glucose level did not significantly affect the estimated relationship between the age and stroke risk. And this discussion addressed the concept of omitted variable bias, emphasizing that this bias occurs when crucial variables are excluded from the model and is leading to biased estimates. In the context of multiple linear regression, the inclusion of BMI and average glucose level is seen as a potential control for confounding factors, minimizing the risk of omitted variable bias. But however, the assessment knowledge that the presence of omitted variable bias depends on a specific data set characteristics, variable relationship, and the relevance of unobserved factors. And these data findings suggest that the inclusion of additional variables did not dramatically alter the estimate effect of age on a stroke risk. And a comprehensive evaluation of omitted variable has necessitates a deeper understanding of the data sets underlying relationship and potential unobserved factors. Okay, now for the question, the null against one side and two side alternative hypothesis for all the variables. Okay, the first one for intercept, the B naught null hypothesis, the B H naught B naught equal to 0, and H1 is B naught not equal to 0. And for H null hypothesis, H naught B1 equal to 0, H1 B1 not equal to 0. As you can see, the p-value for the intercept b naught is 0.0154, which is less than the typical significance level of 0.05. Therefore, there is evidence to reject the null hypothesis, suggesting that the intercept is statistically significant. And the p-value for H b1 is 1.32231 multiply with 10 power of negative 12, which is extremely small. And this suggests strong evidence to reject the null hypothesis, that indicating that age is statistically significant. And for the BMI, the B2 null hypothesis, H naught B2 equal to 0, and the H1 is B2 not equal to 0. And for the average glucose level, B3, H naught B3 equal to 0, and H1 B3 not equal to 0. And the p-value for the intercept B naught is 0.3048, which is greater than 0.05. Therefore, there is insufficient evidence to reject the null hypothesis, suggesting that the intercept may not be statistically significant. And the p-value for H B1 is 6.95726 multiplied with 10 power of negative 11, which is extremely small. And similar to simple linear regression, this suggests strong evidence to reject the null hypothesis, that indicating that age is statistically significant. The p-value for BMI, B2, and average glucose level are 0.5351 and 0.4200 respectively, and these values are greater than 0.05, indicating that insufficient evidence to reject the null hypothesis, and therefore BMI and average glucose level may not be statistically significant in the multiple linear regression model. Okay, now for the question, do you think that the independent variable together do a good job of explaining variation in the dependent variables? Explain. So, in the descriptive statistic for the independent variable, the age, BMI, and average glucose level, is offer insights into their central tendencies and variability. And mean and standard deviation also provide information on average values and split. And positive skewness and kurtosis for average glucose level also indicate a rightward skew and a more peak distribution. Range, minimum, and maximum values underscore the variability in the data, with average glucose level exhibiting the widest range. And overall, the summary highlights key characteristics of the variable, including the central tendencies and distribution shapes and variability. So, I think that the independent variables, the factor, do a good job for explaining the variation for the dependent because it's very related for the stroke and the variable, the age factor, age, average glucose level, and the BMI is very related. And so we move to the last question. Do you need to add a quadratic function to the equation? I think for me, there's no need to add a quadratic function because all the information, all the calculation in the data that I have done is very helpful to understand the formula, the equation, to understand the title of this project, the goal for this project. For simple linear regression with age, we get the f-test value is 57.38, and as the overall significance of the regression model, and the low p-value for age is 1.322, multiply with 10 power of negative 12 indicates the age is statistically significant in predicting the dependent variable, implying a significant linear relationship. And for the multiple linear regression, the f-test is 19.31 and associated with the p-value determine the overall significance of the model. And additionally, individual p-value for each coefficient, the age, BMI, and average glucose level is help evaluate the significance of individual variable, and the low p-value for age in both simple linear regression and multiple linear regression suggests its statistical significance in predicting the dependent variable. So in summary, the test value and p-value collectively indicates that age play a significant statistically significant role in predicting the dependent variable, emphasizing the simple linear regression and multiple linear regression model. So I think there's no need to add the quadratic function to the equation. So I think that's all from me. So thank you.